The Sine Institute of Policy and Politics is American University's incubator for policy innovation. We convene leaders in the academic, public, private, nonprofit, and journalism sectors to engage and promote common ground and nonpartisan solutions. In an evolving world, we seize the opportunity to work on the nation's most pressing challenges through collaboration by experts and top scholars in their field with students in research and scholarship. As part of that goal, the Sine Institute leverages American University's location in our nation's capital, the nexus of government and a growing international business center. We connect diverse perspectives from around the country and around the world with our world-class academics and research, experienced practitioners, and the most politically active student body in the U.S. We stand apart through our focus on the role of business and the nonprofit community in public policy, the rise of the importance of economic regions in the United States, and international policy issues. Our focus is to make an immediate impact at the intersection of policy and politics that leads to real and lasting change. Thank you for joining us as we convene, communicate, and collaborate. Reimagining America, our global perspective, with your moderator, Carol Gallagher, Senior Associate Dean, the American University.
Good evening. My name is Carol Gallagher, and I am the Senior Associate Dean here in the School of International Service at American University. It is my pleasure to host this webinar today. In particular, I want to thank the Sine Institute of Policy and Politics for organizing it, and my school, the School of International Service, for co-sponsoring it. It's now my pleasure to welcome tonight's guest, the Right Honorable Helen Clark, the former Prime Minister of New Zealand and the co-chair of the Independent Panel for Pandemic Preparedness and Response. Helen Clark was the Prime Minister of New Zealand for 3 successive terms from 1999 to 2008. Throughout her tenure as Prime Minister and as a Member of Parliament for over 27 years, Helen Clark engaged widely in policy development and advocacy across international, economic, social, environmental, and cultural spheres. She advocated strongly for New Zealand's comprehensive program on sustainability and for tackling the problems of climate change. She was an active leader in her country's foreign relations as well, and I know that she's working on this as we speak with Afghanistan. In April 2009, Helen Clark became Administrator of the United Nations Program for Development, UNDP. She was the first woman to lead the organization and serve 2 terms. At the same time, she was also chair of the United Nations Development Group, a committee consisting of UN funds, programs, agencies, and departments working on development issues. As administrator, she led the UNDP to be ranked the most transparent global development organization. She completed her tenure in 2017. Welcome, Prime Minister.
Thanks very much, and thanks for having me.
So I'm going to ask you a bunch of questions about your role on the panel, on your role in dealing with the pandemic, and we're going to look at sort of what your report found and also some of the recommendations going forward. But I want to start with just the general question, which is, you've been living this for the last year and a half, as we all have, but you've been doing it in a very different way. What are your impressions right now about where the world stands vis-a-vis COVID?
Well, thanks for the opportunity to share a few perspectives. And as you say, we've all been living with this for more than a year and a half now. My living with it accelerated quite dramatically when I was asked by the Director General of WHO to become a co-chair with President Ellen Johnson Sirleaf of Liberia of the global review of the experience. That was asked for by the World Health Assembly in May last year, and I think they probably thought that by the time we reported, it will all be done and dusted. Well, to get to the nub of your question, it's far from done and dusted. It's a pandemic still of the unvaccinated and also of the vaccinated. And you see in your news in the United States every day the examples of the vaccinated getting it too. But at least vaccinated, the chances of being hospitalized and severely hurt by it or killed by it are rather less. For the unvaccinated, it's dramatic. Now, in high-income countries, the rate of vaccination is 20 times what it is in low-income countries. Of the number of vaccines that have gone out there worldwide, only just under 3% have gone to the 52 poorest countries in the world. So this pandemic is raging because of inequalities, because of the insufficient vaccine supply and inequitable distribution of the supply. So I'm extremely concerned because as long as transmission rages anywhere in the world, we're all at risk. We're at risk of these new variants that become more transmissible, like Delta. They may have the impact variously of impacting young people more. They may be more lethal. We really don't know what's coming at us as transmission continues to rage.
Well, so when I think about all the jobs you could take in the world today, this job sounds nearly impossible. Why did you take it, and what did you want to do with it? What was your sort of goal when you took it?
Well, it was with a sinking feeling that I took Dr. Tedros's call because he had earlier asked me for some input into who I thought could do the review, and I gave some suggestions, and then he came back and said, "No, Helen, I want you to do it." And I thought, oh my goodness, because you start with literally the World Health Assembly organization asking for the review. Other than that, a blank sheet of paper, no staff, no work program, nothing. And President Sirleaf and I had to put on our skates, as the saying goes, and assemble a panel, a secretariat team, get a work program, and deliver a report between the request for us to do it in July last year and the World Health Assembly in May. So we had to move fast. We got fantastic people on our panel, great staff, enormous interest, very supportive governments. And let me say for the record that both the previous US administration and the current one have been tremendously supportive of our work, and that's mattered a lot to us. It's been very, very helpful. So I guess I did it out of a sort of, over optimistic sense of duty that one could make a difference in helping the world understand what had happened. Because if you understand that, then it's becomes an easier step to say what could avert this next time. We also directed our recommendations to what needed to be done immediately to arrest the pandemic. And clearly there's a lot of focus on that, and has to be, because we have to try to stop it. But if we don't put in place the architecture for the future, we will repeat this lesson. Those who don't learn the lessons of history will be doomed to repeat them over and over.
Well, when your report came out, I think it came out on May 12th of this past year, there was still a sense of urgency in the report. I mean, I think the way you all described it is that the world is still in the throes of the pandemic, and there was the possibility of things getting worse. Here in the United States, we were beginning to open up in May. I think New Zealand maybe was opening up around the same time, but you still saw problems on the horizon. Were you surprised at how much worse it got after that, or did you sort of see it coming at that point?
Yeah, but we saw it coming, and that was why, with our recommendations, we divided them into two sections. The first said, this has got to be done now. And the second set said, but don't miss the opportunity of this crisis to put in place something better for the future. Look, we were very conscious from an early stage of our inquiry that there was a possibility that in high-income countries we would get ourselves vaccinated and think we could go back to some kind of life as it had been. That's not the case. This virus is very good at finding its way through whatever walls we're putting around it, of adapting to the circumstances we offer it. And it's become a cliche, but it's true, that none of us are safe till all of us are safe. So I'm double vaccinated with the Pfizer jabs. I just took my 99-year-old dad to get his jab yesterday. So, we can feel we're looking after ourselves, but we know that we may not be protected against what's coming down the track as transmission rages elsewhere. So we need much more global cooperation and solidarity on this, and we definitely need the manufacturers to scale up, to decentralize their places of production and get the product out there, not as a one-off effort. We're going to need to revaccinate, boosters, this is going to be an ongoing challenge, I suspect, for the rest of my lifetime and beyond.
Well, your panel found weak links at every chain in terms of preparedness and response. I just want to give you some examples that you know about from your report, but the audience may not. You said that preparation was inconsistent and underfunded. Can you give us some examples of where you saw that and what it looks like on the ground?
Yes. So every step in the chain. So firstly, I think, and this also speaks to one of our recommendations, it is vital that WHO gives clear and precise technical guidance as to what countries need to do to be prepared. Now, of course, even with that guidance, what you can't dismiss is the political factors. The truth is there were countries with good health systems who could have dealt with this, but populism got in the way. Populism has been disastrous for the pandemic. Governments have to realise that you have to listen to science and the best public health advice, listen to the epidemiologists, and use your best judgment accordingly. But where you get denial, you get human disaster. So we've recommended that WHO does now provide that clear guidance, clear targets, and that there be a universal periodic peer review process, country one to the other, which is reported. And we suggested a global council that would actually keep an eye on this process, so that everyone knows where every country stands. Now, you can't do that, of course, as the Kiwi saying goes, on the smell of an oily rag. The poorest countries need support to be well prepared. There has to be solidarity funding. It's not huge money, globally speaking. We estimate, 10 billion a year. If it was 15 billion, it would still be cheap at the price. That would enable everybody to have the necessary supplies on standby, and the staff trained, and more ICU, intensive care capacity, and so on. As well, you need funding for the first 100 days response, because if you can get on top of an outbreak like this in the first 100 days, you save yourself a lot of misery later. That needs funding to be leveraged, probably up to about 100 billion. And we suggested, the formula for this needs to be like an assessed contributions formula to an international organisation, from each according to their means, to each according to their needs, and you have a distribution formula. So this is all very practical. Countries haven't had that precise guidance, frankly, and if we go back to 2015 and the great agendas, one of them often overlooked was the Sendai framework for disaster risk reduction. It was prophetic in emphasising the pandemic risk and the need for disaster risk reduction to incorporate pandemic preparedness and response. So back to some basic principles here. So this whole issue of lack of preparedness and response mechanisms was huge. Now, if I went a layer below that, look, several things are clear. Firstly, universal access to health services. Where you have undocumented workers, people afraid to come forward if they're sick or for testing, people worry that might lead to a deportation, people worry that the cost of seeking access might bankrupt their family, and catastrophic health events do bankrupt families around our world. Where there's a lack of universal social protection, it's very hard to run an effective pandemic response. So in the longer term preparedness, universal health coverage, which is a global goal, and universal basic social protection become extremely important.
How do you convince populists that they need to do this? In particular, I'm thinking about immigrant communities. And in the United States, we have a lot of immigrants who are called undocumented, meaning they're not here with the papers that they would, would allow them to work wherever they want, and to use the court system, all of the rest of it. So how do you convince populists that you need to vaccinate these people? There were people that said they shouldn't receive the vaccine.
Well, in the end, look, if we can't appeal to their, better side, then we have to point to self-interest. Every undocumented worker, every marginalised person who can't get vaccination and services becomes a health threat to the rest of society. When you look at some of the responses around the world, I mean, Singapore has a great health system, and Singapore had a good early response to the pandemic. But what got away on them was COVID among the migrant workers. They were documented, by the way, because immigration is pretty strict in Singapore. But there's about 1 million migrant workers, and they are living in less optimal conditions than the average Singaporean. And the pandemic got away among those workers. I suspect the same is true of the Gulf and other countries which rely a lot on a migrant workforce which lives in less than ideal conditions. So the message is, again, none of us are safe to all of us are safe. We can think that in our middle class existence with health coverage, that we're fine, we're going to be okay. But if we leave these chinks in our armor as a society of not looking after the vulnerable and the marginalized, we're all going to be hurt.
Your report also said that the alert systems were slow, and this I really want you to elaborate on, too meek. What do you mean by that? What did you all mean when you said that?
Right. So if we go back to the beginning, as far as we can judge it, we know that doctors, responsible doctors in the hospital in Wuhan noticed the cluster of cases of pneumonia of unknown origin. When it's not just sort of one person with something of, it's a cluster, doctors know that you got to report this for testing. And they did that. And the result of that, from recollection, some 9-10 days or so, was that the Wuhan authorities issued a bulletin to their own hospitals saying there is this cluster of cases of pneumonia of unknown origin, and to be on guard, in effect, an alert. That was what the WHO and other scanning systems picked up, right? It was never an official advice from the government of China. So then the WHO starts asking questions, but then you get into the complexities of the international health regulations, where the WHO is not empowered to immediately get on a flight and fly to the location of an outbreak with its experts. It needs permission. Permission is not always quickly forthcoming and wasn't in this case. It needs information urgently. Mm-hmm. It's not forthcoming as quickly as it should be. It needs to be able to publish information to start to alert the world to what the emerging understanding is. It needs to be able to act in a precautionary fashion where you have a respiratory virus on the move. That obviously has huge possibilities of transmission. Look, one of our fundamental recommendations is empowerment of the WHO and its Director General. This may need to come through a new treaty. It's interesting that the International Health Regulations Review Committee concluded no change was needed to the regulations. Well, look, we think there is a need to change international law and clarify it as to responsibilities of member states and duties and powers of the WHO. If the WHO had more cooperation at an early stage, more information, able to get to the site fast, full disclosure, able to act in a precautionary fashion instead of having to wait for absolute evidence, things would have moved faster. As it was, January was pretty much a lost month, and that was a month clearly where the virus began to move outside China. Having said that, the declaration of the public health emergency of international concern, the highest level of warning of the WHO, was made on the 30th of January. Most countries kind of sat around and looked at it and thought, oh, isn't it interesting what's happening in China and the odd case in Thailand, Korea. I think it really wasn't until the cases started to run out of control in the north of Italy that most countries in the West got the message that this was dramatic. In my own country, we came from a standing start. 28th of January, our health ministry reports the first case detected in New Zealand and said in its press statement, the risk of community transmission is considered low. Hello? Saying that when the World Health Organization a month before has issued a public health emergency of international concern. I mean, this is just indicative of how countries around the world were reacting. not fast enough. And one of the lessons that has to come out of this is when the WHO issues one of those emergencies, and it's not that common to do it, right? Zika, Ebola, SARS, etc. When that's issued, you push every go button on your pandemic preparedness and response. You don't sit around and wait till it hits you. So the rest is history. Lost month in
Why
January.
do you think
Month.
why do you think so many countries sat around? I mean, was it complacency? Was it, thinking, well, it wasn't the previous, respiratory viruses weren't as bad as predicted. What do you think was going on there?
What I think was going on was that we had, by and large, dodged a lot of bullets. So if I think back to SARS in 2003, I was Kiwi Prime Minister. It made so little impact. I can't even remember anything about it. And yet it was a global health emergency. If SARS had got away, it was very deadly, very, very dangerous. But when I checked back on the record, I found that one of the things our government did do, led by our health minister, was a review of the experience of what we did. And we then passed new legislation. So we had a learning come out of this. And our Epidemic Preparedness Act of 2006 actually then put us in good stead to deal with this pandemic. But that was our response at the time. So we dodged a bullet with SARS. Most of the world did. We dodged a bullet with swine flu. Most of us dodged a bullet with Ebola. Sadly, DRC, Uganda, the West African 3 countries didn't. Very, very traumatic. Most of us dodged a bullet with Zika. So I think there's sort of a complacence that says, oh, yes, the WHO has issued an alert, but, the worst has never happened before. We've got to realize that an alert issued at this level is a serious alert. It's not something you sit around and think, oh, well, yeah, okay, that's what they think in Geneva, but it probably won't happen here.
Right. You also mentioned, and we talked about this with migrant populations all over the world, but the report also says that the response, I guess, at the global level, but also at a national level all over the world, it exacerbated existing inequalities. So we talked about migrant populations. What other groups were affected, more negatively affected by COVID than others? And their situation got worse, not just in terms of health, but the existing inequalities.
Yeah, so the poor got poorer, and where poor countries had lockdowns with no social protection, well, it's pretty devastating. From an early stage of those lockdowns in that kind of March, April, May period last year, we were seeing the faces of the poor from around the world on a TV screen saying, I'm going to die of hunger before I die of COVID, which may well have been correct. And that's why I made the point earlier, if you don't have some kind of basic social protection, it's very hard to take a strong public health measure. I mean, here in New Zealand, we obviously kicked in with our unemployment insurance, wage subsidies, business subsidies. The show went on. We had deep pockets and still do. But many countries didn't have anything remotely like that. So the poor got poorer and the poor got sick. Very specifically, women and girls have been big losers. And it has impacted in a health sense, but in other senses. UNESCO estimated there were 11 million girls who would never get back to school after the lockdowns. Now, for those girls in poor countries, the fate is to be pushed off into a forced early marriage, forced early childbearing, greater chance of maternal death, thwarted aspirations, and not able to reach full potential. And when we look at real recovery from COVID, we need to look at second chance for those who've been so dramatically affected. Needless to say, children around the world have missed out on a tremendous amount of education. And again, in richer countries like my own and yours, we've been able to pivot to online learning. In New Zealand, modems and iPads were sent out to poor families who didn't have connectivity so the teachers could reach the children. But, if you're looking at rural Ethiopia, the tiniest proportion of the rural poor households even have a radio. So to broadcast education is very, very difficult. So for the poorest, lost livelihoods, far greater levels of hunger, maybe upwards of 125 million people more pushed into extreme poverty from COVID. David Beasley of World Food Programs talked about the risk of the near doubling of those of the brink of famine, which would bring the numbers to 250 million globally. The missed education, sexual and reproductive health services, women not able to access contraception, safe abortion, prenatal, birthing and postnatal services. That leads to more maternal mortality, children missing out on the vital early immunizations. That spells death for small children. And then the domestic violence issue, which affects women and children the most. So, I mean, this has been a shocker on all of these dimensions. And by the way, has also put the Sustainable Development Goals in this human development area pretty much out of reach. We've got huge catch up if there's to be any meaning attached to
decades, I'm imagining. So getting to these inequalities, I think vaccine inequality is an issue now. I think in the report, of course, the numbers may be a little bit different now, but you all say there's 5.7 billion people in the world age 16 and over, and all of them need access to safe and effective COVID-19 vaccines. This is not some aspiration for tomorrow. It is urgent now. But we know that people in the West have been vaccinated more frequently than people in other parts of the world. How do we do this? How do we make sure that the vaccines get distributed more equitably?
Well, it's very, very tough, and we had quite a bit to say about this in the report. And for the record, we support the TRIPS waiver, and it was a huge boost that the US administration came in behind that, but it's not going to happen anytime soon. And recognising that, we said other things need to be urgently done, that the high-income countries who had ordered twice as many doses as they needed, fact, right? High-income countries had ordered over 4 billion doses for, and if we say 2 each for a population in high-income countries of about 1.16 billion. So they've got doses to spare, and they need to get out there. Unfortunately, some of those that have got out there so close to expiry date that poor countries couldn't use them. So we called on a redistribution of 1 billion doses by the 1st of September, and for another 1 billion redistributed from high-income countries by mid next year. Now, look, there has been some stepping up. The G7 knows the urgency of this, but they're not coming quickly enough, is the key point I'd like to make. We have low-income countries who haven't yet been able to vaccinate their frontline health workforce, let alone vulnerable populations. So the redistribution is very urgent, and the vaccines are there for it. Secondly, we called for radically scaled up production. We called on WTO and WHO to urgently convene a meeting of the vaccine manufacturing countries and companies to get a breakthrough agreement on that. That meeting has been held, by the way, but again, the concern is the slowness. Look, there's been an agreement to put a facility in Cape Town or South Africa somewhere. There's been an agreement to put something in Dakar in Senegal, but this isn't going to be done overnight. So whatever can be done to ramp up production, decentralize it out to countries with known capacity. Brazil's been a great generic manufacturer. Obviously, India, South Africa has capacity. We have to ramp it up because it's not just an issue of redistributing the stock we have. We don't have enough vaccine being produced to do the job that needs to be done.
Is intellectual property causing issues?
Yes, and you see that this mRNA vaccine innovation is an enormous innovation, and so very, very profitable to Pfizer and others who've got it, and they haven't been quick to share, shall we say. Look, our panel is really coming from the viewpoint of Dr. Jonas Salk, who invented the Salk vaccine for polio, which I was a beneficiary of as a young child when it rolled out in New Zealand. And when he was asked whether he would become a rich man as a result of the invention, he said, "Good grief, no. This is a gift to humanity." That is the ethos we need now, not companies making record profits, but recognizing that humanity at this hour needs these products and needs them now. Now, they shouldn't need to wait for a TRIPS waiver to wave a big stick. This needs a very rapid voluntary licensing of the capacity to produce, and investing in the knowledge and technical capacities and transfers to make it happen.
Do you think the WTO could do anything about this? I mean, right now, I guess violations of intellectual property can be policed by the WTO. Could the WTO do something to stop that, to not police it, to allow people to make the vaccine in contravention of intellectual property standards?
So when you get a TRIPS waiver, it's not like there's no royalties paid. These products clearly are still on license, but if countries issue compulsory licensing, they still expect to pay for the product they're receiving. It's also got to be borne in mind that governments like your own one, the United States government, UK government, Germans, many others, even my own country in a small way, we've all invested in vaccine development. There's been a tremendous amount of public money go into this. And I think a lesson for the future is when public money goes in, it should go in with a rider about the extent of availability of the product. My own personal view is that when we're faced with a pandemic, we should have a standing TRIPS waiver for intellectual property, because faced with a pandemic, you are going to get public money chucked at the problem, right? And I think that also must carry with it a responsibility to make the product available.
Right. Let me ask you a little bit about how different countries handled the pandemic inside of their boundaries. Your report analyzed 28 different countries' responses. And one of the things that you noted in the report is that some countries adopted very aggressive containment strategies. China, New Zealand, Republic of Korea, Singapore, which you already mentioned, Thailand and Vietnam. Why did they do it differently? What did they do differently? And I guess more to the point, was it the right strategy? Did it work?
Yes, it worked, and it continues to work. You can never relax your guard. Look, New Zealand had one of the best responses in the world. New Zealand took a zero tolerance approach. We do not tolerate community transmission. We went into a 7-week lockdown in March, April, May last year, and we got rid of community cases. We had another smaller outbreak in August last year. We locked down Auckland where it was centred. We've had a couple of flurries since. We've got another flurry at the moment. One Delta case from New South Wales where there hasn't been sufficient action to curb the pandemic. So we're in a level 4 lockdown at the moment. We will not tolerate it because we don't want to see our people destroyed by this. And we will get through it because we know what works, but Delta is obviously more challenging. So in the list of countries you read, of course, a number of them are from the Asia Pacific region. And perhaps what that speaks to is that SARS was a very real threat in the Asia Pacific. Swine flu was a very real threat. So there is some more awareness, I think, in East Asia of these issues. So you need a strategy which says we're going to throw everything at this. We won't tolerate community transmission, and we'll do whatever it takes. And that's been pretty much the lesson. I must say, eventually from China, when it got on top of it, doesn't tolerate community transmission. Korea, Singapore, Taiwan's been very successful. Again, like New Zealand, you get a bit of leakage from your border, but they jump on it very, very fast. But I think there are also some other factors with the more successful responses. And there's been a lot written about the women leaders around the world and how they led on the pandemic. I think what the most of the women leaders exerted, firstly, was empathy. They made it clear that the health of the population was the central issue here. They turned a deaf ear to the siren calls which said, oh, what about the economy? they made the judgment, and in my view, this is the correct judgment, that the best economic response is the best public health response. Because if you have a fearful, unconfident population, they're not going to consume, they're not going to invest, they're not going to be able to go to work, they're not going to be productive. So they put human well-being first, and that was communicated to their public. Secondly, they communicated very well. They were factual, and they not only communicated the empathy, but also, I think, often with women leaders, there's less ego involved. They're prepared to acknowledge what they don't know, to say we're acting on the best advice that we have. They were listening to the experts, and they said, here's what our judgment is. In New Zealand, every day, except the seventh day, there's a break taken during a lockdown. Our Prime Minister appears on our television screen at 1 o'clock, and she spells out the facts as we know it and sends out the clear messages. That's leadership. She takes it on her own shoulders, and of course she gets brickbats, and everybody's got an opinion, but you're never left wondering what is the government strategy. So these are some of the key ingredients of successful responses.
I think back to last April and May here in this country, we had been on lockdown for, I guess, 5 weeks or so, and people started having protests in state capitals about the anti-lockdown protests. We're still having them about masks. How do you do this? What you all did in New Zealand? How do you do that in a culture that is very frontier-esque, and there are just elements of people that simply refuse to play by the rules?
So I
Did
think
you all talk about that? Because I think we're not the only country. I think ours is pretty bad, but I'm just curious if you all considered that.
I think it also speaks to deeper issues about the societies, the extent to which the societies hang together, in which everyone feels they've got a stake, a shared interest in what's happening. It speaks to the degree of political polarization in the society. The US has become, sadly, extremely polarized. In our own country, we have robust politics, but we also have a capacity to pull together. And we've been through some big issues in recent times where we do play to the team of 5 million. We say we're all in it together, and we endeavour to work out to the different communities, and we are a diverse society, to pull everyone together. I look at the UK, which has had a pretty bad pandemic, but also I think quite a lot of social solidarity, even despite all the challenges. So COVID is causing us to ask many questions about our societies. What is it that we do well? What don't we do well? How could we build this greater sense of, look after your neighbour? We're all in this together. And I think we also reflect in this on the role of fake news, and the way in which very, very harmful and damaging ideas to the public health have been able to be spread pretty much unhindered. We look to the responsibility of political leaders to tell us the truth, to be upfront and honest about the advice that they're getting, and to give the public health people and the scientists their head in putting the facts in front of the public. So there's a lot of issues here.
Did your panel deal with this question of disinformation? So I mean, you have misinformation, which is people spreading false information, but they don't realize it's false. And then you have disinformation, where you have people, malevolent actors, who are spreading false information. They know it's false and they want to muddy the waters. We've had a lot of that here, but it's not just in the United States, around vaccines and around COVID itself. Did your panel discuss how to handle that, especially with social media?
Yes, well, we use the term the infodemic because the world's peoples have been deluged with information, right? Some of it total rubbish and damaging, and others quality. And we again, put the emphasis back on the importance of the leadership of governments and authorities to be communicating in honest, upfront, truthful ways with their populations, and making it clear what the best judgment is, what the consensus is, and ensuring that that information gets through. I mean, I don't know what's happening on your cell phone or social media, but in New Zealand, every time I put up an Instagram story on and I hashtag COVID-19, I get an alert from the New Zealand government. You mentioned COVID-19, here's the link to the information, So same with Facebook and so on. So that they're right onto it, wanting to make sure that people on social media sites get authoritative information links. I do think we need to keep pressure on the tech platforms to be purging platforms of harmful and dangerous information. We've been through this debate before, obviously, with bullying and terrorism, and we've now got it with the pandemic threat. So open, honest, upfront communication, governments being onto it, using the public health and information channels they have. But again, if there's elements of the public that don't have any trust in authorities, that's a fundamental issue that isn't easily overcome, and trust isn't easily rebuilt.
So the thing about your list of the countries that have approached this with an aggressive approach, New Zealand is a democracy, but many of the countries on there, not entirely, but some of them are fairly authoritarian. Is there something from the authoritarian approach that that was different from the way New Zealand did things? I mean, I'm just curious how you think about an aggressive containment policy without authoritarianism in the mix.
It's interesting that in the more successful responses, they ranged across political systems, from the authoritarian system of China to, shall I say, quote, guided democracy in Singapore to full-blooded Western democracy with a full panoply of rights that's enjoyed in New Zealand. So the difference in New Zealand, I guess, from the authoritarian responses is that throughout the pandemic, when the state was using the full powers of the Public Health Act and enforcement, throughout that, and again in the lockdown we're in now, we keep parliamentary scrutiny. There was a new mechanism invented of a pandemic response oversight committee chaired by the leader of the opposition, which met virtually 3 days a week, hauled ministers and senior officials in front of it, asked all the questions that needed to be asked. There was a robust political debate that carried on in this very, very structured way, with the media following it avidly. And look, obviously, I've been a Western Prime Minister. I'm very committed to democratic values. That, in my way, is the gold standard way of doing it.
Well, we have 15 minutes left, and we have a lot of good questions here. So I wanted to move to the question and answer here. And so this is a good time, by the way, if you're in the audience and you would like to ask some questions. But we have a question from Samira. In your role, how do you feel about ivermectin treatment? And if you do think it is effective, why is it not being discussed? Is it another tool to protect children who may be exposed and cannot get the vaccine?
Look, short answer is I have no idea, because I haven't had time to put much effort into the therapeutic side of it. I've had the odd person on social media come through and ask exactly that question. I've said, look, you need to go to authoritative public health information. I always take a lot of notice of what Dr. Anthony Fauci says. I take a lot of notice of what the public health authorities say here. So just look for the best public health advice. Don't take information off Facebook. What is Dr. Fauci saying? What's the responsible authority in your country saying?
What about boosters? We have a question from David. For those of us who've been double vaccinated, when will the booster be essential for us to take?
Could be quite soon. We're starting to see the studies now that say that, and I've seen particular reference to Pfizer, that after 3 months the antibodies start reducing, and that by the time you get to the 4 months time, Pfizer's no more effective than AstraZeneca. So, I mean, that's what I'm reading. But here's the ethical dilemma. I mean, the poor WHO stuck with these ghastly figures of low-income countries being 20, well, less vaccinated, high-income countries being vaccinated at 20 times the rate of low-income countries. We're talking about boosters in New Zealand and the US, and a lot of people haven't got their first shot, and there's a limited supply. So this is a really tough issue ethically, but we are going to need boosters. That's why we need this radically ramped up production. It's not just a one-off to get 2 jabs into everybody's arm. It's an ongoing process of continuing to tweak the vaccines so that they will deal with the variants that are coming down the track. We will need boosters. Let's be reconciled to that.
And you think the boosters will be something like the flu booster, the new flu vaccines we get every year that respond to what's out there, or?
They'll respond to what's out there, but there's also vaccine innovation. And what I hear, and again, people could do their own search on this, but what I'm hearing is that there's an innovation coming down the line which may be more effective even than mRNA in putting up a shield against variants of the virus. It might take a different approach to attacking it. So, science is our friend here. We will get innovation. And I think if we're looking for a bright light out of all this, I mean, the world's scientists have come into their own. There's been just the most incredible effort to produce vaccines which are effective within, a relatively short period of time. Where would we be without that? And we're going to need to continue to put public support into research, but let's also make sure that the benefits rolled out as widely as they can.
Another question about countries that are not vaccinated or generally have high levels of vaccination right now. And so while they're waiting for pharmaceutical help, what's the best thing they can do to keep their infection rate low?
Masking obviously extremely important. And again, while to us the cost of a simple paper mask may be nothing, for a poor country or family that's living off trading charcoal on the side of the road, it could be the day's takings. So again, solidarity, support for the response means support not only for the vaccines, important as that is, but also for basic supplies. People need masking. Basic public health measures to the extent that they're possible in the most fragile environments, like the social distancing. I mean, images come to mind of the crowded tents in Cox's Bazar where the Rohingya refugees are. It's pretty tough. So whatever can be done to help basic public health measures is extremely important.
Well, what in your report, when you talked about the immediate things that we need to do, what do you think were the top 2 or 3 that right now we should be trying to do, and then in particular in places with low levels of vaccination?
So we said deploy all public health measures at disposal, and the public health measures in a sense haven't changed down through the generations. I understand that when the pandemic hit, the German authorities went back and looked at what they did in the 1918 flu pandemic. So it is social distancing, it is isolation of cases and quarantine, masking, obviously, just constant communication with people. If there's a queue, keep distance. This is a respiratory pathogen, and with Delta on the loose, people passing each other in the street can get it. So if I were in a country with rampant transmission and low levels of vaccination, I wouldn't go to the market. I wouldn't go outside my house without a mask on.
But people still have to go to the market. So really the masking is
Masking's absolutely critical.
And what is WHO doing right now in countries with low levels of vaccination? Like, what are they doing in Dakar, for example, or what are they doing in rural Senegal or places like that where the vaccine is in short supply?
So WHO has country offices in every developing country, and they will be in very close daily, hourly contact with health ministries supporting them to get the best guidance they can out to populations. Obviously, WHO is also passing the hat around for contributions to the COVAX scheme on vaccines as well. But it will be advising countries on masking, effective communication with publication, with communications. And, I mean, I have a colleague who worked in one of the lower income Southeast Asian countries who's told me exactly about that kind of work, and quite an effective early response, just relying on basic public health measures.
So we have in the Washington region right now, universities are coming back. American University starts next Monday, August 30th. The public school system in Virginia started this week. And some schools further south, for example, started a week, even prior to that. So I know that this is probably a first world question in many respects, but when you all looked at the effects on children and what to do about taking care of children and making sure they don't have too much learning loss and also but that they don't get sick, how did your panel think about this and handle this? And you may not have put it in the report, I'm not sure, but
yeah, we didn't dwell a lot on that in the report, but we did commission background papers, which are on our website, on the socioeconomic impacts, and obviously the loss of access to education was one. I'm very conscious that schools and universities in the Northern Hemisphere are preparing to go back, and I think it has to be with a precautionary approach. Vaccines do need to be rolled out widely to that younger age group. 12's up, I understand, is now the likely advice. And I think where there's community transmission, as there still is, as far as I can see across the USA, and I know this may be politically controversial in the USA, but look, I'd have the kids with masks at school, frankly, because what you don't want is the transmission coming out of the school to a fragile and vulnerable relative. And there are people who, on health grounds, may not have been vaccinated. I mean, even I wondered, should I take Dad, who's 99 years, 5 months and 13 days old, for his vaccination yesterday? Well, I did, because he's stoic and survived 2 depressions, World War II, and the rest of it. But there are people who, on health grounds, may be advised not to get it, and you don't want them to die.
Mm-hmm. So, I mean, with lockdowns, one of the responses that many of the countries that took aggressive containment measures used was lockdowns. Do you think that's something that we should be continuing to do? I feel like in the United States, there's sort of a sense that we're done with lockdowns, that there's a deep weariness with it. But is it something that should still be in the toolbox?
Yes, definitely in the toolbox. And, particularly, where countries have the means to fund people through it is an effective tool, and maybe one that, states at that level would want to impose. Look, just speaking from the experience of New Zealand, we're a developed country, but also a set of remote islands. Our nearest neighbours, the Kingdom of Tonga, which has no COVID. Australia is 1,200 miles away and has a raging pandemic in New South Wales. We can isolate ourselves. Our border's been closed since March last year. Very hard to get into New Zealand, hard to come and go. I haven't left the country since March last year. So we're sitting it out. We're starting to look at how we would, once we achieve a high level of vaccination in the country, how we will gradually open a bit more, but take it as read that people will not be able to get on a plane and come to New Zealand the way they used to. They will need to show a pre-departure test. They'll have to have an on-arrival test. If they're coming from a red zone country with a lot of COVID, likelihood is they'll have to pay for their 2 weeks quarantine. If they're coming from a country with a very low rate of transmission, it may be that we ask for a follow-up test at 3 days after isolation. But that's the way we're going to manage it. For most of the time since mid-May last year, our people have enjoyed going to the football stadium, the theatre, family gatherings, restaurants and bars, because we've had no community transmission. And that's the way we like it to be. And we will put up with constraints to keep it that way.
So we have a question here from Lucy. It's not about the pandemic, but Lucy is very happy that you are here, and she thanks you so much for being here. And she wants to know, as the first woman PM of New Zealand, what are your thoughts on the future of women's political leadership in the world? And will the US ever have a woman president? What will
Oh, I
it take
hope
to
so.
reinvent America and achieve parity in politics? It's a
Oh,
great question to end with.
I'm living for that day and for the first woman Secretary General of the UN, by the way. So I was the first woman to win a general election for my party in New Zealand. I actually succeeded a woman prime minister who was put in by an internal party room coup when the government before mine wasn't doing so well. And actually, that was tremendously helpful to me because it normalized things. There was a woman leader of the opposition and a woman prime minister. And then we reversed roles. She became the leader of the opposition. I became prime minister. Jacinda is our third woman prime minister. So for well over half of the last 24 years or so, New Zealand's had women prime ministers, and that's the expectation now. Women will get to the top, and hopefully, at least half the time. So what it takes is, obviously an acceptance in the political culture that women can and should do these jobs. It also calls, I think, for people to stop using double standards when judging women. When I was fighting my way to the top, well, I use the word fighting. People don't particularly like women fighting. Actually, they often don't particularly like strong women. So they tend to sort of categorize women who have the strength to do these jobs as somehow tough and unfeminine, and that's not nice, and the whole set of stereotypes set in. And there are double standards. So everyone has to pinch themselves and say, yes, she's strong, but she has to be. The media carried quite a lot of responsibility in this as well. Even now, Jacinda, I think, faced barriers that Jenny Shipley, the first Prime Minister, and I didn't face. We were older women. We were past childbearing age. So there wasn't going to be questions about that. But she faced intrusive questioning about whether she would have children. When she had a child, then the critics started saying, how can she devote attention to the job? Most of our male prime ministers have had children. No one ever asked that question. So there's all these double standards and gender stereotypes about what women can do if they've got children. Then, of course, if they don't have children, like me, the critics will start, trying to make issues of that. So, yeah, we need to, as societies mature and recognise that women have a right to be in these places. What I say to young women is, you see that chair, it's got your name on it. You go for it. You've got every right to aspire to that.
So it can happen, Lucy. Talking to our person here on the Q&A. So we've got 1 minute left. I want to ask you, what's the one thing you want all of us in the audience here to know going forward about COVID?
Going forward, we're all in it together. The US is being generous with the international response. I can only encourage you to continue that. I really thank the US for the support it's given our panel and its work. The US being a force for global cooperation to beat this is absolutely critical. And thank you for what you're doing.
Well, I want to thank you so much for coming and visiting with us, Prime Minister. This has been a great conversation. I also want to thank the Sign Institute for sponsoring this and for SIS for agreeing to chip in and co-sponsor it. I also want to say to all of you that this recording can be found on the Sign Institute's YouTube channel, as well as all of the other programs that were done earlier in the summer through the Reimagining America series. I also encourage you to follow both the Sign Institute, SIS, AU, and the Prime Minister on Twitter. And I want to say to everyone, thanks for coming and have a good night. And Prime Minister, I know you're in the morning, so have a good morning.
Thanks, everyone. Thanks for the opportunity.